But I thought we'd do something a little different today. This is called thinking about an issue. And it may seem a little foreign to many Americans, but let's give it a whirl. What do you say? You know that little thing called universal health care? Sounds great. I mean, it's universal. Not a single person will have a cough ever. Over in the UK, they're lucky enough to have it already. And the government must have hoped for a change because they've just made a pledge. And if a government pledge can't solve a problem, what can? I hope there's no more change. They pledged that if you go to the emergency room, you will be seen by a doctor in less than 4 hours. Wow. Reaching for the stars. How are they meeting that lofty pledge? I don't know. I did some investigation. They actually call it something called patient stacking. And the union that represents the ambulance staff in the UK says it's rampant. Basically, when a patient arrives at the hospital, instead of moving them inside so they can be seen by a doctor, no. They make them wait in the ambulance until they know they can be seen by a doctor within the 4-hour time limit. Some patients have had to wait in the ambulance for up to 5 hours before going inside, where they could wait an additional 4 hours. That's not just bad for the patient, that's also bad for the person who needs the ambulance because they can't get one, because they're all parked outside the hospital with sick people inside. The worst example of the tragic story of Luke Gallimore. This is a 16-year-old leukemia patient. His doctor requested a transfer to intensive care, calling it extremely urgent and absolutely critical. He waited an entire hour, contacted the ambulance control. They said, sorry, you have 3 crews ready to pick him up, but ER wouldn't let them offload their patients. He added, quote, it's politics and it's not fair on your patients. Well, while waiting for the transfer, Luke Gallimore slipped into a coma. He died 16 days later. If you think this is an isolated incident, then you're wrong. Guardian reported there were more than 43,000 ambulance delays of an hour or more in the last 15 months alone. What a pledge that is. Universally cool. Now, I know a critique of universal health care isn't effective as saying, hope and change 3,000 times in a row. But it is something to think about. If you want to know what else is in store for us, sign up now for our free email newsletter on our special report on liberal fascism. It's happening all this week exclusively for free at glennbeck.com. From New York, good night, America.